In 2021, I had a teacher who was 51-year-old and working as a teacher, and she had been on a waiting list for their lumbar disc surgery for 8 months. Her surgeon and doctor said it was inevitable. 3 months later, she cancelled her surgery. She has not needed it since. Today I'm going to show you those exact 3 exercises that change their outcome and why this works and everything else fails. So the pelvic tilt is the foundation of the lumbar spine and the hip. This resets the relationships between lumbar spine and the pelvis, and that's where we start with the pelvic tilt exercise. I know it looks simple, but hear me out. Most of the time people do it wrong, because most of my patients don't feel it in the beginning because they're doing it wrong, and that's exactly the problem is. So let's check it out. What we do is you lay on your back, bend your knees, flatten the feet, and gently relax your spine. That is the important part of this exercise. So this is not a crunch. You're not bending it, you're only relaxing it, and it is a tilt. So you're only rotating your spine, you're not really crunching or bending it. Then hold for 2 seconds and release and repeat for 15 times. So make sure here we do not have a gap when we are doing the pelvic tilt. So your back is completely flat on the ground, and then you lift up a little bit and then the flat again. So we're not crunching or really bending it. Actually we are flattening it or doing a pelvic tilt. This is the first exercise, and it's very safe. Again, if you have a radiating pain that is severe enough that you can't do this motion, avoid it. I think this is not the right time for yourself. Next exercise, which is very important, is the glute bridge. Your glute muscles are the engine of your back. So when they stop firing, which happens in almost everybody who sits for a long time or who are not moving as much, their glute becomes weaker or not firing enough. Their lower back muscle has to compensate and starts to overwork and take the work from the glutes, which they're not supposed to do. And that's where your back pain starts, and it increases the muscle spasms and eventually affects the disc and the joints. So again, you lay on your back, both knees bend, and then push through your heels and lift your bumps up. So you're lifting in a way where you lift your hips up, your shoulder, hip, and the knee are in the straight line. That is a good bridge. And then you're going to target to squeeze and give a little bit more activation of both the gluteus muscles. Hold for 2 seconds and don't let your lower back arch or bend, and you repeat for 15 times and then see how you feel. So now third exercise, and this is the exercise that changes everything. This is called dead bug. I know it's common name, but when it's done properly, it has a great effect. So it's not a core exercise, it is the spine stability exercise, and there is a critical difference between them. So how do we do it is you go on your back, bend your knees, and your arms relaxed on the side, and arms relaxed on the side, facing up. And then here the most important part is you relax your tummy and flatten your back, not half flatten or a little bit flatten, completely touching the land or the ground where you're laying on it, and that's what the flatten means. I will explain the reason why, because a lot of time we are trying to relax or crunch, but if it's not flattened, we're not engaging the important muscle we are going to use here. Then you're going to lift your both knees 90 degree and lift your arms up towards the ceiling. Here we are going to use the transverse abdominis muscle by sucking the tummy in and tightening up, and this is where your muscle that is deeper level and stabilizing the spine are going to start activating. Now slowly lower your right arm and right leg simultaneously, same time, towards the ground slowly, and then bring it back. And same thing we're going to repeat on the other side, where you can slowly lower the arm towards the knee and then your leg towards the floor. As you move this, make sure we contract the muscles in the tummy here, and that is the stabilization that's happening. So here the part of the exercise that is important is not the leg motion, it is the core muscle or the stabilizers in here. So as long as you can tuck it in, you're good with this exercise. Or in a second way, as long as you can keep your hand behind your back where you can feel your back is touching the floor, then that is properly done. This exercise we're going to do 8 reps of 3 sets or 2 sets, and this is the one of the exercise where you can hold a little bit, or you can do 8 reps on the both side, means 16 reps in total, and 2 or 3 sets. This 3 exercise only takes 7 to 8 minutes every day. Do these 3 exercises for next 3 weeks and come back and let me know how you are feeling. I reply to every single comments and also discuss about the problems.